Do you have like chronic low back pain issue that just like keeps coming back over and over again? You get adjusted, you go to a chiropractor and it feels better temporarily and then it comes back. And you've had this issue for maybe years at a time. You go to your doctor's office, they take some x-rays or something, they tell you that you have some joint arthritis and sorry about your luck, but this is just the rest of your life. I got an exercise for you that might solve that problem, especially if you have a facet joint problem. So let me show you what the facet joint is, why it becomes an issue, and how to solve that problem with an exercise at home. In this area of your spinal column, this is called your thoracic spine, this is called your cervical spine, and this is called your lumbar spine. And lumbar spine issues are typically where the facet joints become an issue primarily. So what I want you to pay attention to is the way that these bones match onto each other. So this bone right here matches with this bone right here at a very particular joint, which you can see from the side, called the facet joint. And as I move them, you can kind of see where that facet joint is. And when you're looking at somebody from the back, it's very easy to see that these joints can slide past each other very easily. And these areas of your spinal column they're designed to move and move well, especially when you're rotating. They just slide past each other. Now, as you go down into the lower part of your lumbar spine, you'll notice that these joints called the facet joints in your lumbar spine, they change their orientation. They're no longer flat facing like this, they're actually oriented like this, and they puzzle piece together on top of each other in this orientation, which is not designed for rotation. So when you go to turn, it opens up this way, but if you turn the other direction, they're gonna bang into each other. Bones don't like to touch, and when they touch, it hurts and it causes pain. Your lumbar spine is not designed to rotate, and a lot of times in my rotational athletes like golfers or baseball players or people who are doing rotationally heavy things like cleaning, for example, is very rotationally heavy, or if you're working on an assembly line and you're constantly rotating back and forth, if you're using your lumbar spine to do that motion, you're banging those facet joints into each other, and that can cause a lot of low back pain, and you get the diagnosis of arthritis when that's not necessarily the problem. Those bones are becoming arthritic because you're banging them together. They're not supposed to bang together, and that is not normal. So here's how you prevent it from getting worse and actually solve the problem so that they don't hurt anymore. If your lumbar spine is not designed to rotate like that, then where should you be getting rotation from if you're not supposed to get it from your lower abdominal section and your lumbar spine joints? Well, these joints here, these are called ball and socket joints. This is your hip socket. It's literally a ball inside of a socket, and it is designed to move in 360 degrees all the way around because it is a ball and socket joint. So most of the rotation is supposed to occur from your hips, and then that last little bit of rotation is supposed to happen from the upper back. Your lumbar spine is actually supposed to be stable, and it's not supposed to move. So here's a really great exercise to keep you in stability during rotation. It's actually called an anti-rotation technique, and it's a modified version of what's called a PALOV press, P-A-L-O-V press, but we're gonna modify it to be an anti-rotational exercise rather than just normal core stability. So let me show you how this works. First thing you gotta do is get an anchor point. These bands are really easily accessible. You can get a pack of these bands online for maybe 20, 25 bucks on Amazon. They're just called exercise tubing kits, and they come with all these hardware, handles, and everything else. But the most important thing that this kit is gonna come with is an attachment for your door. So it comes with like a little ball on the end of an attachment. You stick that into the frame of a door, and once it's in the frame of the door, the band will just loop around it, and you can recreate what I'm about to do without having anchors in your home. You just close it into the frame of a door and you can recreate this exercise. Once you have it, what you're gonna do is you're gonna get into a nice athletic position, I call it. So feet are shoulder width apart, your hips are slightly underneath your shoulders, and your knees are slightly bent. Your butt is kind of back this way. You don't really want to round in this position, so your butt is back. Nice proud chest, okay? Stick your chest out. The first thing you're gonna do is you're gonna take this band and pull it towards your belly button first. Once you get it to your belly button, then you're gonna attach with the other hand and press straight out this way. And the band is going to want to pull you in this direction. And what you're doing is you're trying to hold it straight out in front of you, and you're going to treat this like a plank. So you're going to hold that for a minute straight. You may not be able to get a minute when you first try to do this. It should be challenging because you may have a rotational core stability problem. You're not supposed to get a minute when you first try. The goal is to get to a minute. So if you can do 30 seconds, then I want you to do 2 repetitions to get to a minute straight. If you can do 15 seconds, then you gotta do 4 reps to get to a minute straight. What you're trying to do is get 4 minutes total. If you can get 4 minutes total straight, right in a row, 1 minute, take a break, do another minute, take a break, and you can get 4 minutes total without taking any other breaks other than the 1 minute intervals, your back pain should go down significantly, and you'll have really strong rotational core stability. So what that's gonna do is that's gonna allow muscles from this part of your core crossing over this part of your back, okay, from the front side of your abdominal core muscles to squeeze and tighten to create what's called intra-abdominal pressure in your lumbar spine and cavity. That will create pressure backwards into your spinal column and keep it nice and strong and nice and stiff. That will also allow for muscles in your hip to allow movement so that once you get that stability exercise and you can really train those muscles to get nice and strong and firm, then you can start playing around with how you're gonna move so that when you can train rotation to come from your hip socket while your core is nice and steady, so you're not rotating from here, you're rotating from here. Those facet joints won't bang into each other anymore. You won't be rubbing joints that aren't designed to rub together, and you won't be irritating a problem, making it worse, and most of the pain will go away when those bones stop banging into each other.